Clinical scenario. A 28-year-old pregnant woman, currently at 32 weeks gestation, presents to the clinic for her routine prenatal visit. She reports feeling swollen in her feet and hands over the past week. Her blood pressure is measured at 160/98 millimeters of mercury, and she has +2 pitting edema in both legs. She complains of headaches and visual disturbances, such as seeing flashes of light. Her urine dipstick shows +3 protein. She has no significant medical history, but her pregnancy has been uncomplicated until now. Which of the following is the most appropriate next step in the management of this patient? A. Monitor blood pressure at home and advise rest. B. Schedule an immediate ultrasound to check fetal growth. C. Administer magnesium sulfate and prepare for delivery. D. Perform a 24-hour urine collection to assess protein levels. E. Start antihypertensive therapy and recommend a low-sodium diet. F. Reassure the patient and schedule a follow-up in 1 week. Answer. D. Perform a 24-hour urine collection to assess protein levels. Rationale. This patient is presenting with signs and symptoms suggestive of preeclampsia, a hypertensive disorder of pregnancy. High blood pressure, proteinuria, edema, headaches, and visual disturbances are classic features of this condition. The most appropriate next step is to perform a 24-hour urine collection to quantify protein levels, which is critical for diagnosing preeclampsia. Once proteinuria is confirmed, further management can include magnesium sulfate for seizure prophylaxis and potential delivery, depending on the severity of the condition. Monitoring blood pressure at home and advising rest, A, is not sufficient for this level of concern. Antihypertensive therapy, E, might be needed but is not the immediate next step.